Greetings. My name is Theresa Ogide-Alaeze. I come to you today to share some information about coronavirus disease. The urgency of now and effective dissemination of information. Yes, we live in a global village. Situational crisis requires contingent leadership and facts. Reported community spread of COVID-19 widely raises the level of concern about the information and immediate threat for the affected community. So relevant is the need to continue to make informed decisions that take into account experts' opinion or subject matters knowledge, institutional guidance such as Centers from Disease Control, World Health Organization and its affiliates, local health department or Ministry of Health, health advisories, public health community gatekeeper such as your local health centers or clinic within your jurisdiction. The fact is clear. Oxygen is a lifeline. Cessation of breath equals death. COVID-19 compromises your respiratory systems and other vital organs. This is an emerging respiratory disease that can spread from person to person and from person to non-object and from non-object to person. So stay alert. COVID-19 is a disease caused by respiratory virus that was first identified in late 2019 in Hubei, Heilp province of China. It is a new virus that has never caused illness in human beings before worldwide. It's as a result of the acute nature of this disease. Thousands of human beings have been affected, causing illness and in some cases death. Causes have spread worldwide in countries, both small, rich, poor, name it anything, emerging country or developed country, as the case may be. Prior to this disease, there were two other coronaviruses known as SARS, spelled SARS, and MERS, MERS. These are acronyms known to cause more serious lower respiratory disease. What is the general public threat? The widespread of coronavirus disease worldwide is occurring, and experts expect that in the coming weeks or months, we can expect to see more cases around the world. How does it spread? It's thought to be spread like the cold, common cold, or flu, or catarrh, coughing and sneezing, which create droplets or respiratory droplet. Close personal contacts, such as touching or shaking hands or hugging, touching an object or surface with the virus. Expert opinion incline that the virus can live outside the human body up to 2 days. What are the symptoms of COVID-19? Fever, coughing, shortness of breath. In more severe cases, pneumonia, that's infection in the lung. Implications for public health. Prevention is key to preventing the spread of transmission and other salient factors that could contribute to the widespread of this disease. COVID-19 is no respecter of person, nationality, race, ethnicity, rich or poor, male or female, old or young. So, we are all at risk. However, the vulnerability of risk may be higher in older adults and individuals with compromised immune system. So, what should we do? Effective dissemination of accurate, correct, and guided messaging on coronavirus is critical to educating the general public as well as population health in preventing the prevention and spread of coronavirus. Too much mixed messaging is a major communication risk. The question though, why the delay in framing targeted messages through community newsletters, community outlets, community radios, newsletters, other outlets, including social media? Please be guided and allow experts in the messaging of facts to the critical mass. So, remember, we are at risk. What should one do if you think you have COVID-19? If you become sick, either coughing, having difficulty breathing, contact your physician or your local health practitioners. And if you are 60 and older, please do not hesitate. With pre-existing medical condition, call your local doctor or your local clinic, as the case may be. For regions of the world known for malaria epidemics and lacking critical infrastructure or resource-poor countries, talk to your trained practitioners and follow up with recommendation. Do not take any medication without prescription. Self-medication on chloroquine and other medication can cause more harm than good. Remember, you are not an island of your own. Always consult with your primary physicians or expert in your area. What can one do to protect themselves from this disease and that of others? Take everyday preventive measure to slow the spread of this disease. Always think locally and act globally. How do you think locally? Self-protection, protection of family members, protection of the greater community or society. How do you think globally? You need to know that your decision to expose yourself can be a critical risk to the global community. We are all in one. We are connected. So think about it. Expert opinion recommends social distancing. The best way to slow the spread of COVID-19 is through social distancing. This means avoiding close contact with others. Social distancing takes many shapes or forms depending on your lifestyle or your family dwelling or situation. Social distance include following certain habit or reshaping your habit or modifying your habit, such as avoiding handshaking, hugging, or other intimate types of greetings. Avoid non-essential travel where necessary. Avoid crowd, especially in poorly ventilated environment or area. Avoid unnecessary exposure of risk by staying at home. If it's not necessary, do not go out there. This disease is real. Wash your hands, often with soap and warm water for about 20 seconds. Also use alcohol-based hand sanitizer for about 60 seconds. Yes, of course, this is a risk for individuals living in an impoverished community without proper sanitation and hygiene. Talk more of hand sanitizer or existing running water. This is real. We must fight this together. When individual cough, cover your mouth and sneeze with a tissue on your sleeve or with your elbow. Avoid touching your eyes, nose, mouth, and other organs or other areas of your body. Clean and disinfect frequently. Touch objects and surfaces using standard cleaning practices. Avoid close contact with people who are sick. If you are sick, experts say stay home, except when seeking for medical care. Practice social distancing. Keep distance between yourself and others and avoid crowds. If one think they are sick, call your doctor. Call your local health department or ministry. Be on a guarded message. Do not just go to emergency room. Contact them first because emergency rooms are crowded. Talk about your symptom to the expert. Tell them how you feel and what it is. If you have traveled outside the country or within the country, the expert need to know. Wear a mask if one is available. Is there a vaccine or medication to treat COVID-19? Currently, no, because this is a new disease. However, many experts are working in developing one. As a requirement, it may take 9 to 12 months for a safe and effective vaccine to be available for population use. Final thought. Understandably, we live in a global village and we are humanly connected. It will take all of us to prevent the spread of COVID-19. Making informed decisions could save your lives, family members, and the greater community at large. Get the facts from subject matters, professionals, institutions, and avoid misinformation driven by fear and alternate facts. COVID-19 is a real-time disease, and we must recognize the urgency of now to deal with it as it is. For more information, visit the Centers for Disease Control, the National Allergy Institute, and also contact me, Theresa, at contact@associatedhealthresources.org. Thank you for listening, and I hope I've shared some useful information. Do not rely on this. Always contact your medical doctor for a follow-up. Thank you. Be safe and promote a healthy and happier global community. Together, we can all fight coronavirus, prevent the spread.